Good morning. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician and gynecologist in New York City, Midtown Manhattan, and I'm bringing to you all things health-related for women. Thank you for joining me here at GYN Corner. Today is Thursday, September 12th. Tomorrow is Friday 13th. And let's see, please check out the YouTube channel. It's also called GYN Corner. Please click the like button, click the subscribe button, and the follow button. You'll get a heads up on presentations, what I'm presenting and when I'm presenting. Keep in the loop. And then please comment and give suggestions for future topics. I'd appreciate that. I want to make sure I'm bringing things that people want to hear about, people are interested in, they want to know about, bringing value to everyone's daily life as far as women and health concerns. Now let's see. Yesterday I had some technical difficulties. I wasn't able to present yesterday, so I'm bringing what I was going to present yesterday, which is breast and the breast during pregnancy. So I thought about speaking on this because I had a patient Monday, I believe it was, who I actually had two patients who were pregnant Monday, and both of them, I always ask the question, do you have any symptoms that you consider unusual or surprising for pregnancy? And both of them said, my breasts are really painful and sore. Is that normal? And I always thought everyone knew that your breasts get fuller and tender and sore during pregnancy. Then I realized not everyone knows that, or maybe they think it, but they're not sure. So I decided to speak on pregnancy and your breast, the pregnant breast. So let's see, with pregnancy, with the onset of pregnancy, what we consider the female hormones, which are estrogen and progesterone, surge. Now those are the same hormones that surge or increase in concentration after you ovulate. So the same hormones that cause the same type of symptoms one has with premenstrual symptoms or 1 to 2 weeks before the cycle, they can have during the onset of a pregnancy, at the beginning of a pregnancy, and throughout the pregnancy. And those hormones are at least 10 times higher with the onset of pregnancy. So estrogen and progesterone work together to increase the development of the breast and its breast tissues for breastfeeding, for milk production. So the breast is made up of fatty tissue, adipocytes or adipose, and mammary ducts. So the ducts, the little tubes that channel the milk to the nipples, and the glands or the cells where the milk is produced. So estrogen and progesterone both work to increase the maturity of those ducts and glands because they're not developed until one is pregnant. So they're present, but they're immature, and they're lacking in the sophistication that they need in order to produce milk. So estrogen helps to increase the proliferation or the production of those glands, and the progesterone helps to build them up and to build up the ducts. Those two hormones work along with a hormone from the brain called prolactin, which once the progesterone predominantly helps to build the proteins that cause the milk, the prolactin helps to enhance them, develop them, produce the milk, and after delivery to actually continue the milk production for however long one wants to breastfeed. Now, because of the increased stimulation of the production of the milk, the glands, the ducts, and the fat, the adipocytes, the predominantly estrogen stimulation causes the breast to stretch and to grow, and that's what causes so much tenderness. So it's the effects of estrogen that cause the pain, the nipple sensitivity. A lot of women will notice that especially their nipples are more sensitive than the rest of their breast. The nipples can get darker or dusky in color, and they get little zits or dots or balls that develop around the tip of the nipple or the dark area, which is the areola. Those little ducts or balls are called Montgomery glands. And they produce an oil or a secretion of sebum that's not obvious. It's very fairly microscopic, but to keep the nipples moist and softened once breastfeeding occurs, because of the constant wetness of the baby's mouth and the milk that's being produced, the nipples will very easily get dry and cracked. So those Montgomery glands are nature's way of moisturizing and keeping the nipples supple as much as possible. Because of the estrogen and progesterone, the production of the milk slowly but surely occurs throughout the second trimester and into the third trimester. At some point in the mid-second trimester to the third trimester, a very immature type of milk is produced. We call that colostrum. And colostrum is almost like a heavy cream, where breast milk is more like not really whole milk, but probably more like between 2% and whole milk, but it's very sweet. So colostrum is a pre-milk production that's more like a thick or double cream. And if someone miscarries or terminates their pregnancy, usually anytime after 16 to 18 weeks of pregnancy, it's the drop in the estrogen and the progesterone, especially the progesterone. It's the withdrawal of the progesterone after the pregnancy has ended that allows for the release and the production or the evidence of the milk. So if someone's pregnancy stops definitely after 18 weeks, sometimes after 16 weeks, she will have milk production. The body doesn't know that didn't make it all the way to 40 weeks or 37 weeks. It just knows that it's finished what it needs to do to prepare for the breast milk. So the withdrawal of those hormones allows for the release and the production of that milk. So we do tell women that early on, that they'll want to keep the breast bound and so forth in order to decrease stimulation and the actual evidence of the milk being produced. Now, throughout the pregnancy, the first trimester, those milk ducts are being stimulated, but it's predominantly the estrogen effects that cause the breast tenderness and the nipple stimulation and the sensitivity and the I don't want to say engorgement, but the enlargement of those secretory glands, those Montgomery glands. Some people call them Montgomery tubercles. So it's preparation for the laying down or the proliferation of the glands and the ducts in the first trimester. So if someone has a pregnancy that finishes in the first trimester, there isn't any ramifications from that. They go back to normal within a week or so. If they continue through the second trimester, all of the actual development and the maturation of the ducts and the glands is done. So if she finishes the pregnancy at that point, she will have milk production. And the third trimester is predominantly a time of volume. So increase blood flow to increase the volume or the mass of the breast and increase maturation. So the third trimester is just polishing off what the second trimester has accomplished. And if someone delivers any time during the third trimester, everything is normal. There isn't any deficit, there isn't any issue, and the milk production is normal. So I hope that's been helpful information on what to expect during pregnancy as far as the breast go. First trimester is tenderness, soreness. Second trimester is darkening of the areola or the colored area at the end of the breast, and enlargement of the nipple and enlargement of the secretory glands around the nipple, and production and increased volume of the breast as far as the ducts and the glands go. And the third trimester is just getting the finishing touches on all of that. This is Dr. McDaniel at GYN Corner. I hope that's been helpful information on the pregnant breast. And please check out the YouTube channel. Please subscribe and follow on the YouTube channel and the Facebook. And if you have time to listen to today's radio, which are podcasts, please check out the podcasts. We're on 8 platforms. Those platforms are Apple Podcasts, Google Podcasts, Spotify, Anchor, Breaker, Overcast, Radio Public, and PCA. Thanks again, and if you're in the tri-state area, come on by the office. The website for the office is Midtown GYN, or midtowngyn.com. It's Midtown Gynecology. We're in Midtown Manhattan, around the corner from Macy's, and west, just a few blocks west of the Empire State Building. Thanks again. Have a great rest of your Thursday. Bye.